You know the liver is important when the word live is in it. You don't hear somebody, giving up their liver, and you have to have it. So it makes a lot of important, it detoxes, you have to digesting food is critical to make bile. You make a lot of key proteins, the metabolism of fats, and it stores a lot of important things like glycogen and B vitamins and iron and copper. And the bottom line with it, when the liver doesn't work properly, we can't live very long. And this is what's interesting is when I was mentioning that when I was a resident and we would see people and they had liver disease, it was kind of a knee-jerk. Liver disease, and what word do you think we would think of? Alcohol. That was kind of the alcoholic liver disease was the thing you would typically see. Now, worldwide, the major cause of liver disease is actually going to be viral hepatitis, particularly type B. Type C is up there too. But now we started to see in the 1970s more and more people looking like they had alcoholic liver disease, but they weren't drinkers. And it looked exactly the same. You'd see the scarring and nodularity, and they would develop cirrhosis. And that raised the question of what's going on, which is what we're going to talk about, and what we can do about it. Autoimmune hepatitis is up there too, chronic liver infections with some conditions that we typically don't see much here, schistosomiasis. Gosh, you got to be careful when you say that. And some genetic conditions like too much iron or too much copper can cause problems. And the interesting thing is, why are we concerned about this? If I were to say, like, why do you not want to have fatty liver disease and for that to progress? The number one thought that I would have had before I looked into this is, well, you don't want to have liver failure and die of cirrhosis. But the number one cause of death in this situation is actually cardiovascular disease. The risk of heart disease goes up dramatically when your liver doesn't work right. Remember, one of the functions of the liver is involved in fat metabolism, and your body just loses its capacity to metabolize the fats. It's also accumulating a lot of toxins, which is going to lead to cardiovascular disease. So there's multiple reasons for that. And cancer rates go up. A lot of our immune system has to do with the liver. And when we have liver decline, we can't fight off cancers. And so we see an explosion of cancers. And of course, you can actually see frank liver failure, which is typically what we would, the stages of this go in, there's kind of ordinary fatty disease, and it can accelerate and ultimately become cirrhosis. Oh, by the way, how do you know you have fatty liver disease? What are the symptoms? Typically zero. You can actually have severe disease and have no symptoms, and that's what's a bit alarming. If you don't get routine blood work done, like the AST and the ALT, which all of you who are HOTC guests would get that regularly, and these labs are actually fairly common, but if they're elevated, that would be a tip-off that this is going on. Another way it's found is just with a routine imaging study. You might be getting an ultrasound for a totally unrelated reason, or a CT or an MRI, and it'll come back with a comment, fatty liver. And often it doesn't try to quantify it too much, but fatty liver is just usually an incidental finding. And I think that's one of the concerning things about this condition is people underestimate the severity of this problem until and they usually don't start thinking about acting until it's late. And I'm hoping as a result of knowing more about this, you won't make that mistake, or you can pass this along to others more likely, and they can take action. But the reason for this is there's not just one reason, but as Dr. Hotze alluded to, certainly weight and diabetes is a big part of this picture. But it's also, you can be quite thin and have fatty liver disease. A high intake of simple sugars is a big problem. Remember when the USDA, the government told us to get away from butter and start using margarine, and we started using corn oils and all the different seed oils. Turns out all of those increase the risk of fatty liver, and it matches in time when everybody started making that switch. So that looks like a major cause of this problem. Artificial sweeteners don't help. Genetically modified foods don't help. You know how Roundup or glyphosate's being sprayed on more and more food? In fact, wheat today has glyphosate sprayed on it just to make it easier to harvest. It's not even necessarily for weed control. And when it's sprayed on food, you can't get it out. And there's also a connection with glyphosate and fatty liver. If you eat more than 12 hours a day, you're more likely to get insulin resistance and you're more likely to get fatty liver. We call it intermittent fasting if you eat less hours than you don't eat, and we would highly recommend that. Although it's kind of a strange term if you think about it, because you're not really fasting, you're just controlling the hours you eat. And I think it was an American who came up with the term intermittent fasting, because to some people, not eating constantly is fasting. But and it's interesting that during the same time frame that non-alcoholic fatty liver disease has been increasing, we've been seeing some other things going on that may or may not be related, like the vaccine schedule has just exploded. You know, we're spraying strange things in the air, and that's not, I used to think that was a conspiracy theory that they spray stuff in the air, but they actually acknowledge that today. And plastics have become more widespread. We also know sleep apnea, if not diagnosed and treated, increases the risk. And we've been on a mission to catch more sleep apnea and treat it, because that really can be a serious problem. And of course, hypothyroidism. And if you know anything about the Hotze Health and Wellness Center, you know we're passionate about going after hypothyroidism and making sure it's thoroughly treated. So all of these things are risk factors for fatty liver disease. And what happens is fat gets shoved into the liver. When insulin is high with insulin resistance, it sends the signal to store whatever you're eating, particularly fat. And that fat gets shoved into the liver. And unfortunately, fat doesn't just sit there doing nothing. It's metabolically active, and it causes inflammation. And that inflammation starts this process where there's injury, and that becomes more chronic and ongoing. And guess what happens when you have chronic inflammation? That injury leads to scarring, and that scarring reduces the function of the liver. And so basically, a liver that is developing this process ultimately starts getting lumpy from these fibrotic bands, which is basically just scarring going across the liver, and it becomes less and less functional. So that's some of the bad news out there. The good news starts with alpha-lipoic acid or lipoic acid. Lipoic acid is the hero flying in with his cape. Fortunately, lipoic acid is something you make. We all make lipoic acid, by the way, but we just make more when we're 20, and as time goes on, we make less. And as we have greater health demands, we tend to make less as well. But alpha lipoic acid actually helps us move sugar into the right places into our cells. It helps reduce the fat accumulation. It reduces inflammation, and it reduces scarring. So it's like in all the points that we would really like to see progress, lipoic acid is there to help. And you might be wondering, I would be wondering if I were you, do we have evidence this actually works? Like, this sounds good in theory, but do we actually know that this can make a difference? And fortunately, we actually do have studies. Dr. Bergson is a physician, a colleague that we've gotten to know over the years, and he has a practice in New Mexico. And he's been treating people with lipoic acid for years. And he published a paper, for example, that showed that of 79 people with end-stage disease, and so these are people who were actually expected to not live. This was a very sick group of folks. 75 were able to regenerate their liver and were effectively healed. And this is an ongoing, and he was kind enough to share the protocol that we use. So we're using a protocol that's been well studied and been shown to be effective. Now, it is IV therapy, and one of the issues that has come up is some folks from out of state will want to know if they can, get the treatment somehow back home, but they do need to be here to receive the treatment. It takes about 3 months for us to do this, usually about twice a week, an IV infusion. After that, most people can be controlled with some oral things that are helpful at reducing fatty liver. And of course, a healthy lifestyle. Virtually all the things in the list that lead to fatty liver, you want to keep in mind. You want to eat less hours and eat healthy food. But that's fatty liver, and we're already have launched that program, and it's available. And so I'm not going to take questions, but write down your questions now and later after we finish. So.